Hello, Amy.
Hello.
Welcome to the show.
Thank you. Thank you for having me.
You're welcome. So before we just start talking about what a doula is and your work as a doula, could you give us a little bit of a background to yourself, where you're from?
Yeah, so I have always grown up around London, so I always say that I've travelled around the M25 wherever I've lived. I grew up West London, and then gradually with work and bits and bobs I've gone around. So I have worked in the childcare and family industry for about 11 years, just over now, and that's gone from working in a nursery to going into nannying and then creating my own business, which was to support women and mothers through parenting. I'd seen so many women in nurseries and in nannying where they were just so confused with how to parent, wanting to parent their best way, but wasn't able to do so. So I started to look at holistic sleep consulting, fell in love with it, started taking on families and mums who were in survival mode and were just trying to get through, sleep deprived and unhappy. And actually talking to them and going through the motion, a lot of the issues they were having were stemming from birth trauma and the postnatal and birth world, where they just weren't being supported the way they felt they needed to be supported.
So, Amy, what motivated you to become a doula?
It was seeing a lot of women have birth trauma and postnatal trauma. Through my sleep consultancy, I learned how a lot of the mums, the way mums reacted and the way mums needed support all stemmed from birth. It made me really realise that more women need to support women going through this area. I learned more about what a doula role was, and I felt that actually it was something that I could offer and do, and I was already doing in some senses with my previous nanny work, working with families with newborn in that area, and I thought actually this is something that is important, and in a world full of politics and things going on in our medical system and birth system, having more doulas is not a bad thing. So I thought that, yeah. And as soon as I started training, I realised that this was my calling as such.
Amy, can you tell us what doula means?
So doula originally comes back to the ancient Greek word gentlewoman servant, which can look very controversial. I think it's beautiful. As a woman, we have a lot of emotions, we care, and a lot of us want to emotionally support other people. And that's sort of similar to what a doula is, and that meaning behind that. When we look at the word servant in this day and age, we take that very heavily and form of offence, where actually if we look back in the ancient Greeks, this word servant was a carer, where they were there to support. So for me, I think the word doula is a really beautiful word. It's a word of caring and love, and actually we have seen doulas throughout the ages. It's not a new thing. It's not something that's just popped up in the modern age. It's something that's been going on for thousands of years throughout history, that is there to support women.
So, Amy, can you tell me what is a stereotypical image of a doula?
Oh, I have quite often been asked, "You don't look like a doula." We see doulas now as this hippie, floaty person that has a bag full of sage and herbs, which I do have a bag full of herbs, do have a bag full of remedies, but that isn't and that doesn't want medication, doesn't want to be in a hospital, and the view is that they've had loads of children and that they believe that births are pain-free and things like that is probably a common misconception of what a doula is, and actually it's completely different. A lot of doulas look normal. We come in all shapes and sizes. The joy of a doula is you can quite honestly have a different doula from the next person. We all have different niches, different areas that we love in birth and postnatal, and different wants and cares. So you do have the ones that don't believe in medical intervention, that very much enjoy supporting free births or home births, and you have the ones that do mixes of births. You have ones, I mean, we now also have to sort of look at the C-section care as well, because that is very normal in our society too. So yeah, doulas look different in all shapes and sizes, and what they offer as well.
So, Amy, can you take us through what you did during your doula training?
So I trained a few years ago now. I took Is There a Doula in You, where it sort of went through the understanding of what a doula is, and if it works for me. And then a few months later, I took an in-person course. It's a week course, but you have coursework before and afterwards. And basically, the course is there to help you understand how to hold space, how to signpost, how to create a space for a family to make decisions. We aren't there in a medical entity, which is something that very heavily you'll hear a lot of doulas repeat a lot of. We're not medical, we're there for you. So we went through scenarios, we went through understanding on antenatal care, on birth, and on postnatal. We did a little bit of understanding medical terms and things like that, but wholly it was how to look after and support a mother to help them make the decisions they need to do, and also how we aren't the main character in this journey of a family. We are there as a side character to boost and create empowerment and support. And that looks different for every family. So it was a really lovely moment to take a breath and realise we're not there to fix, we're not there to solve, we're there to help and support in a safe and create a safe environment for families to feel power and feel control over their decisions.
Do you think that doulas put mothers at risk for pushing a so-called natural birth?
There's this thought, isn't there, that because we've sort of touched on it, of doulas being this hippy-dippy, woo-woo person, that we're going to push, and we're so against medical intervention. We're going to push and be like, no, this is what mum wants, this is what we're going to do. Our role is to make, again, I know I've been repeating it quite a lot, of making that space for the mum to make the decisions, and to also listen to what medical staff are saying. So there's a great word that we can use is brain. So what are the benefits of going down this path? What is the response? So what's going to come out of it? How is it going to help us? What are the alternatives to what we've been going down the path? You know, if mum's at home in a home birth, well, actually, is it going to benefit her from going in? Instinct, what's that gut feeling? What is that? What is that mum and dad's gut feeling about the issue? And nothing. Do we actually need to do anything? Can we take 5 minutes to make the decision? Or do we need to make the decision now? Using the acronym can really help. Just sit and think, what do we need to do? Taking sort of a breath to think clearly. I think if a doula is pushing a natural birth on themselves, they're not doing their role of allowing the mum to make the decision.
So tell me, what's the difference between, let's say, having a doula instead of a private midwife at your birth?
If you're wanting more of a medical support, say that you're really worried about birth trauma, you've had birth trauma in a previous birth, you want more somebody to check you while you're in
Blood
labour
pressure,
and things like
yeah.
that, then you would want to go with a private midwife. If you're looking for more a doula again, we can't do any of that because that's all medical. So the way we can work is creating that space for you to make those decisions. So the difference would more be financially, what can you afford, but also what are you trying to gain out of this birth and what support are you wanting? We both would be there consistently. We both offer similar things in a sense of that care. But it's just depending of the medical care, if you're wanting more medical, or actually the understanding of what a doula is that actually what you need is just somebody to protect your space, protect your surroundings, and allow you and have empowerment to be able to make those decisions for yourself.
And be an advocate for the
Yeah,
world.
and be an advocate, yeah.
Yes.
So, you know, the advocacy looks so different. It could be sitting outside of a room to make sure no one comes in. It's that continuous care, which of course private midwives can do as well. But the joy of a doula is you can be in a family's life from the day that they pee on a stick and they get those lines come up, or a few weeks before birth and they're needing that care. You can be that continuous support that as soon as they go into labour, you're around, you're virtually there once you are encouraged to go and asked to go into their space. You can be there and support them and protect them. So protect their space to create that advocacy for them.
See, I think that's a very important point. I think that it's almost you are holding the hand of the mother throughout pregnancy, birth, and postnatal period, if that's what the mother wants.
And I think in the maternity system right now, there's a lot of pressure and there's low staff because of the pressure, because of the high turnover and the high burnout that we see. Is, you know, you could be in the middle of pushing and there has to be a swap over, a handover. And we, you know, at first I saw that as a negative, but actually there's also a person at the end of that of a 12-hour shift, an 8-hour shift, with potentially not a break, and they need to hand over and they need to swap because we're all human. And, you know, we see the pressure that they're going under, but when you've been going to all your antenatal appointments and it's a different person every time, they can't help that. But actually, as a first-time mother or a second or third-time mother, that can be really scary. And to then have somebody that you can talk to afterwards that have a little bit of an understanding, or can go away and find a little bit more information out to bring back to the mum, is so reassuring. Because you could have an amazing midwife for the first appointment, and the second appointment you could have a midwife that has had a really bad day and is just a little bit sharp, and you could be quite anxious, and that sharpness can really affect you. And they don't, most of the time they don't mean that, but it's the way it's effective. So then having somebody at the end of a phone or can come around for coffee and just sit with you and go through what you've been told and go through that environment. And a lot of times I've been hired because of an antenatal session, going quite sharp, being quite hard. Then like, actually, we need extra support here to sort of protect that time and to actually know somebody. And it can be a very scary period of time. So to have somebody that you know, and you know, going through those contractions, not knowing how long that's going to be, and then see that person walk through the door that you've built a relationship for months or weeks or even days sometimes, and you just see them just breathe out and their shoulders stop, a drop, and you think, okay, all right, we're okay. We have this, we have somebody that we know with a friendly face.
What about if the mum, whether you were there or not, has gone through birth trauma? Is that something you can help her with after birth?
Definitely. And that looks different. You can have just a brief debrief session with a professional or a doula. A lot of people do different debriefs. You've got hypnobirthers, you've got baby massage instructors. Lots of people do different debriefs in different ways. So you can sort of have a power hour, which are fairly affordable as well. To be just go through everything you've been through, learn some tools, and to sort of digest what you've done. I always think that's a great thing to be able to do. So if you don't really want to hire a doula, or you can't afford to have a big payment like that to have that one-to-one support, a debrief is really helpful. Having a postnatal doula is also helpful to be able to, sometimes I don't even hold the baby. Sometimes I've never touched a baby. It is literally sitting there for mum, like we are now, having a piece of cake and a cup of tea and chatting about what's going on, talking about how they are feeling.
Amy, could you tell us how a doula can support you after birth?
You've suddenly got this little baby that is relying on you, which is quite scary at times. And you're like, I've got to keep this thing alive. How on earth am I going to do it? And quite literally, we, in our system, our medical system at the moment, there has been a basis to support that postnatal period, but actually it's been lost because there's more focus on supporting that birth, which is so important, but the postnatal has been forgotten about. So we do have midwife checks, and then you do have extra help in that area, but it is very more like a tick box exercise now. They do want midwives and healthcare professionals do try. There's a lot that want to, but you have a time slot, and that can be quite hard. So in the postnatal care, a lot of the help is answering questions. Is this normal? The second night of the crying and baby's grunting and baby's making noise while I sleep, is that normal? Well, yeah, it is. There's not an issue. Is it normal that my baby's weeing when the nappy's off? Yeah, completely normal. You don't need to worry. That was one of my favourite questions recently. I was like, no, you don't need to go and have an investigation. That is completely normal. Please don't worry. And then getting home, you've got a completely new dynamic now. Is dad going straight back to work, or is he able to take some rest and spend time with you both? Do you have family around? Do you have friends around? What can that look like? So postnatal care, the main sources of care that I would say to look for is the aftercare for yourself. What does that aftercare look like for you? Your nutrition, who's going to be doing the cooking, and then also if you have other children around, what's the care going to look like for them? Do you have additional care for them? Are you their main care provider as soon as you come home with baby? And how does that look like? So those are, that sort of to think about for the postnatal care.
Thank you so much, Amy.
Thank you.
Thank you.